It's really no surprise that smoking is the leading cause of lung cancer.
85% of time is still tobacco smoking.
It was hoped vaping would help lower lung cancer levels, but according to medical oncologist Arik Dudik of Regions Hospital, vaping isn't a free pass to inhale.
It does still contains volatile aromatic agents, compounds that can cause cancer.
In a cruel twist, you can avoid smoking all of your life and still be susceptible to lung cancer from environmental factors like radon, asbestos, car exhaust, and secondhand smoke.
It is estimated about 7,300 individuals die from lung cancer that is caused by secondhand smoking.
The cancer strikes most often between the ages of 55 and 65. Common symptoms include chronic cough, coughing up blood, chest pain, shortness of breath. There are two major types: non-small cell lung cancer, which is the most common, and small cell lung cancer, which spreads more quickly.
Can we actually cure lung cancer? And the answer, yes, we can. We can cure the cancer when it's discovered in the very early stage.
The problem is, not many people get screened.
Only 4% of people who are eligible actually getting screened, so we really need to make a better effort.
And right now, all lung cancer programs in Minnesota are underutilized.
If someone is a current smoker or former smoker, they should talk to the primary care physician to be part of the lung cancer screening program.
Dr. Dudik's tips for maintaining lung health: if you're a smoker, quit. Check your home to make sure it has acceptable radon levels, and get regular exercise such as walking at least 30 minutes a day.